Dear students, today we are going to deal with the PSC mock test 4, okay, model paper 4 for Kerala PSC Assistant Dental Surgeon upcoming exam. So without wasting time, let's move on to the first question. Ptosis may occur due to damage to, the options are trochlear nerve, oculomotor nerve, trigeminal nerve and superior oblique muscle. So ptosis may occur due to damage to oculomotor nerve. Option B is the right answer. Second question, the muscle which has no action on jaw opening. So geniohyoid, mylohyoid, temporalis and digastric. Among all of these, temporalis does not help in jaw opening. So temporalis is the answer. Okay, option C. Third question, the first arch artery. So which is the first arch artery? Maxillary or mandibular? Definitely option A, maxillary artery is the first arch artery. Okay, so option A is the right answer. Question number 4, parotid fascia extends anteriorly as deep cervical fascia, fascia lata, mesenteric fascia or stylomandibular ligament. The parotid fascia is extending anteriorly as option C, mesenteric fascia. Coming on to fifth question, philtrum of the upper lip is derived from which process? Maxillary, mandibular, mesoneedle or medial nasal or lateral nasal process. Philtrum of the upper lip is derived from median nasal process. Option C is the right answer. Question number 6. In central nervous system, the myelination is carried out by. So read the question carefully. In central nervous system, not in peripheral nervous system. In central nervous system, myelination is carried out by option C, oligodendrocytes. Okay. Seventh question, which of the following vitamins is necessary for maturation of the blood precursor cell? Vitamin A, thiamine, riboflavin or cyanocobalamin. So as we know, cobalamin is very important for what? Maturation of the blood precursor cell. So option D, cyanocobalamin is the answer. Question number 8, a diet deficient in calcium will result in. So here they are asking about the calcium metabolism. Okay, so according to calcium, when the calcium level goes down, what happens? The antagonist, the parathyroid hormone production will increase, and to increase the calcium level in the blood, the bone resorption starts. So according to the options, option 4, production of parathyroid hormone and bone resorption takes place whenever there is deficiency in calcium. Okay. Question number 9, which of the following has growth hormone stimulating activity? So which one is growth hormone stimulating activity? IGF-1, somatostatin, REM, sleep or ghrelin. Okay, so which one is growth hormone stimulating? Ghrelin. Option D is the answer. Question number 10, which of the following is not a marker of bone resorption? Alkaline phosphatase, it is a marker of bone resorption. Osteocalcin is a marker of bone resorption. Procollagen marker is also a marker of bone resorption. Hydroxyproline, option D, is not a marker of bone resorption. Question number 11. Secondary amyloidosis is seen most commonly in actinomycosis, tuberculosis, rabies or secondary Lewis. Secondary amyloidosis is seen in tuberculosis. Okay, option B. Question number 12. All of the following about prostaglandins and leukotrienes are correct except, so we have to read all the options. Option A, arachidonic acid is metabolized to form prostaglandin and leukotrienes. That is correct statement. COX-1 is inducible in many tissues. No, that statement is little doubt. Okay, question number option C. COX is induced by cytokines at the site of inflammation. Yes, definitely COX is induced by cytokines at the site of inflammation. Last option, leukotrienes cause bronchoconstriction. So the last statement is also correct. Leukotrienes will cause bronchoconstriction. So the one which is a wrong statement here is second option. Okay, COX-1 is inducible in many of the tissues is a wrong statement. Okay, so the answer will be option B. Question number 13. Serum sickness syndrome is a transplant immunity, anaphylactic shock, systemic Arthus reaction or none of the above. Serum sickness is a systemic Arthus reaction. Option C. Okay. Question number 14. Syphilitic gamma. Syphilitic gamma is seen in primary syphilis or secondary or tertiary syphilis. Syphilitic gamma is seen in tertiary syphilis. Okay. Correct sequence of cell cycle. So it is a by heart for everyone. G0, G1S, G2M. So option A is the right answer. G0, G1S, G2 and M is the sequence of cell cycle. Question number 16. Which of the following anesthetic drugs produces powerful stimulation of the cerebral cortex? The one which causes powerful stimulation of cerebral cortex is, among the options you have to choose cocaine, procaine, lidocaine and tetracaine. So the one with the high stimulation among the four is cocaine, option A. Question number 17. A patient has had an allergic reaction with urticaria and wheezing, the drug of choice. So the patient is having two reactions, urticaria as well as wheezing. So the drug of choice will be epinephrine or hydrocortisone, succinylcholine or all of the above. So since the patient is having both the reactions, the correct drug of choice will be epinephrine. Option A is the answer. Question number 18. Progestin compound that does not alter lipid profile. Okay, progestin compound that does not alter lipid profile. Medroxyprogesterone or norethindrone or gestodine or levonorgestrel. Okay, so the one which does not alter the lipid profile among this is gestodine. Okay, option C is the answer, gestodine. Question number 19. The pigment which is the telltale sign of free radical and lipid peroxidation, hemosiderin, melanin, lipofuscin and bilirubin. The pigment which is the telltale sign of free radical and lipid peroxidation. So option C, lipofuscin is the answer. Okay. Question number 20. Which drug causes osteoradionecrosis? Bisphosphonates, arsenic, lithium or tianeptine. Okay, the one which causes osteoradionecrosis among the four is bisphosphonates. So option A is the answer. Question number 21. Category C drug. So category A, B, C, the category C drug in pregnancy. Okay, so in pregnancy, anesthetics comes under category C. So lidocaine is the answer. Okay, amoxicillin, corticosteroid, erythromycin, among the four options, category C drug in pregnancy is lidocaine. Okay. Question number 22. Key enzyme in urea synthesis. Okay, urease, carbamyl synthetase, arginase or ornithine. The one key enzyme in urea synthesis is carbamyl synthetase. Option B is the answer. Question number 23. The enzyme involved in the first committed step of glycolysis. Phosphofructokinase or glucose 6-phosphatase or hexokinase or enolase. So the first step in glycolysis, the enzyme involved is phosphofructokinase. Okay. Option A, phosphofructokinase. Now question number 24. NADPH is required for what? For gluconeogenesis or glycolysis or fatty acid synthesis or glycogenolysis. NADPH is required for fatty acid synthesis. Okay, option C is the answer. Mineral which is present in vitamin B12. Which is the mineral which is present in vitamin B12? Selenium or cobalt or iron or calcium. The one which is present in vitamin B12 is cobalt. Okay, so option B is the answer. Negative phase is seen in which type of immunity? Active immunity or passive immunity or herd or local? Negative phase is seen in active immunity. Okay, option A is the answer. Question number 27. Electron microscopy was introduced by, Ernst Ruska. Okay, so option C is the answer, Ruska, Ernst Ruska. Question number 28. Group A carbohydrate of Streptococcus pyogenes cross-reacts with which part of the human body? Synovial fluid or myocardium or cardiac valves or vascular intima. Group A carbohydrate of Streptococcus pyogenes cross-reacts and will injure the cardiac valves. Okay, so option C is the answer. Question number 29. Which of the following are the characteristics of Vincent's angina? Except. So the question is except. So ulcerative gingival stomatitis comes under Vincent's angina. Caused due to malnutrition? Yes. A symbiotic infection? Yes. It is caused by Leptospira interrogans? No. Okay, definitely not. So the answer will be option 4. Question number 30. The presence of which of the following factors in virus makes the protective vaccines a possibility? Enzymes, protein coat, polysaccharide or lipids. So presence of which part of the virus helps us in protective vaccines a possibility? So definitely a protein coat. Okay, a protein coat, option B. Question number 31. Transverse ridge is prominent on the occlusal surface of which of the following deciduous teeth? Okay, so be careful with the question. They are asking about the deciduous teeth. Okay, transverse ridge is seen in which deciduous teeth? It is seen in mandibular first molar. Okay, deciduous mandibular first molar. Okay, a ratio of mesiodistal width to the height of the crown of maxillary canine. So the mesiodistal width to the height of the crown of maxillary canine is in which ratio? The ratio is 8:10. Option B is the answer. 8:10. Question number 33. One of the following dental notation is known as universal notation. So which is universal notation? Cunningham's notation. Okay, option B. It's an easy question. Question number 34. The ridge that descends from the cuspal tip towards the central part of the occlusal surface in a maxillary molar. The ridge that descends from the cuspal tip towards the central part of the occlusal surface in a maxillary molar is known as the triangular ridge. Okay, so option A. Question number 35. The tooth bud for the third molar is initiated at about the age of. The only tooth bud which is initiated after during this one. Okay, so after 5 years is during the 8th year of life is the third molar. So option 4 is the answer. So third molars are initiated at 8 years of age. 36. The total number of germ tooth present in a full form fetus. In a full form fetus, except third molar, all the tooth germs will be formed. So in deciduous 20 and in permanent 28. Okay, excluding the third molar tooth germ. So 20 plus 28, 48. So total 48 tooth will be, the tooth germ will be present in a full form fetus. Okay, question number, option 4 is the answer. Question number 37. Dark band that are present in an enamel rod at intervals of 4 microns. So within an enamel rod, dark bands are present, which are known as cross striations. Okay, option B. Question number 38. Fluid flow in or out of the dental tubule is proportional to the tubule diameter. To what diameter? Okay, so it is proportional to the 4th power of the diameter of the tubule. Okay, question number 39. Primary response of pulp to the tissue destruction is necrosis, ulceration, calcific degeneration or inflammation. So the primary response of a pulp to the tissue destruction is always a inflammation first. So option 4. Question number 40. Type of cementum located in the furcation areas of multi-rooted teeth. In case of a multi-rooted teeth in the furcation area, the cementum will be a mixed type. Okay, so and that was cellular variety. So cellular mixed stratified cementum. Okay, so option C is the answer. Question number 41. Ideal pulp floor depth for amalgam restoration in a primary molar is 0.5 mm from the DEJ, 1 mm from the enamel surface, 1.5 mm from the DEJ, 3.2 mm from the enamel surface. So ideal pulp floor depth for amalgam restoration of primary molar is 0.5 mm from the DEJ. Okay, 0.5 mm from the DEJ. Question number 42. In air abrasive technology, the abrasive particles used are iron oxide or tin oxide or aluminum oxide or silicon oxide. In abrasive technology, the abrasive particles used are aluminum oxide. Option C. Question number 43. Whenever the caries cone in enamel is larger or at least the same size as that in dentine, it is called as. So which means the caries is moving forward. Okay. So the option C is the answer. Forward caries. The caries cone in enamel is larger or at least the same size as that in dentine, which means the caries is moving forward. So forward caries. Question number 44. Which of the following is common to both zinc oxide eugenol cement and polycarboxylate cement? Both of them are having the same liquid. Polyacrylic liquid? No. Both of them are having a chemical bonding to the tooth structure? No. Both of them are having a chelation reaction? Yes. Okay, so option C. Which of the following is a common to both zinc oxide eugenol and polycarboxylate cement? Both of them are having a chelation reaction. Question number 45. Mechanically, the strongest phase in amalgam restoration. Original phase or gamma 1 or gamma 2 or copper tin phase. Original phase is always the stronger one. So Ag3SN, original gamma phase is the strongest phase in amalgam restoration. Option A is the answer. Question number 46. The objective of the access cavity preparation is to gain direct access to which area? Actually, it is not to pulp chamber, it is not to canal orifice. The objective of access cavity preparation we have learned in endo is to gain direct access to apical region, apical foramen. Okay, so option C is the answer. Question number 47. Pain due to acute irreversible pulpitis. So irreversible pulpitis means spontaneously you will get the pain, and the pain will be very sharp also, and it will last for a very long time. So option C is not correct. Option D is correct because it is both spontaneous and sharp. So both A and B options are correct. Okay. Question number 48. The best instrument for cutting dentin. Always best instrument for cutting dentin is a reamer. Okay, reamer. So reamer is the answer. Question number 49. In Inkel's method of endodontic working length determination, safety allowance means what? In Inkel's method means safety allowance is put to avoid the possibility of image distortion or magnification. Okay, so option A is the answer. Question number 50. In post-core, which of the following gutta-percha technique is used? In a post and core method, which type of gutta-percha technique is used? Okay, we always go for a sectional method of gutta-percha technique. Okay, multiple pulp stones are seen in which syndrome? Multiple pulp stones are seen in which syndrome? Okay, multiple pulp stones are seen in Ehlers-Danlos syndrome. Okay, not Down syndrome, not Marfan, not Upwards. It is seen in Ehlers-Danlos syndrome. Question number 52. Strawberry tongue is associated with scarlet fever. Remember S. Okay, scarlet fever. S. Okay. Question number 53. Which of the following is not associated with gingival lesion? Herpes is associated with a gingival lesion? Yes. Pemphigus is associated with a gingival lesion? Yes. Pyogenic granuloma? Yes. So recurrent apathy is not associated with gingival lesion. Question number 54. The yeast which shows thick gelatinous capsule and positive for mucicarmin. So the yeast should have a thick gelatinous capsule. So histoplasmosis is not an answer. Blastomycosis is not an answer. Paracoccidiomycosis is also not an answer. Thick gelatinous capsule and positive for mucicarmin. Cryptococcus neoformans. Okay, option A. Question number 55. Beefy, red and painful tongue is characteristic of vitamin E deficiency or any periodontal disease, acute nicotinic acid deficiency or ascorbic acid. You get a beefy, red and painful tongue when you have nicotinic acid or niacin deficiency. Okay, niacin deficiency or nicotinic acid deficiency. Okay, option C is the answer. 56. Condylar cartilage is in mandible is held to be a primary or secondary or tertiary cartilage. It is a secondary cartilage. Okay, condylar cartilage in mandible is held to be a secondary cartilage. Growth modification procedures are best carried out in which stage of Singer's method? It is carried out in the stage 2. Okay, Singer's method. In a newborn child, we generally see maxillary protrusion or maxillary retrusion or mandibular protrusion or mandibular retrusion. We always see a small mandible. So, mandibular retrusion. Okay, option D is the answer. Mandibular retrusion. We see a bigger smaller mandible. So mandibular retrusion. Okay. Safety valve mechanism is, what is safety valve mechanism? Anterior posterior increment in the maxilla at the age of 14. Mandibular intercanine width increase at 14. Increase in mandibular height at 12 years or increase in maxillary intercanine width at 12 years. Yes, safety valve is concerned with maxillary ridge. So there is increase in the maxillary intercanine width at 12 years. Okay. Question number 60. Butterfly test is used while identifying mouth breathers. Very easy question and answer. Butterfly test is used to identify mouth breathers. 61. Hyperactive mentalis activity seen in class 2 division 1 or 2. It is seen in class 2 division 1. Okay. Hyperactive mentalis activity is seen in class 2 division 1. What is WITS analysis? Cephalometric analysis or model analysis or computer analysis or space calculation analysis? It is a cephalometric analysis. Okay, WITS analysis. Question number 63. When mandible lies 2 to 3 mm posterior to the maxilla, it is a class 1 relationship, isn't it? There is no much greater increase in size. So, when the mandible lies 2 to 3 mm is normal. It is a class 1 relationship. 64. Coil spring action can be described as what type of action? Omnidirectional, axial, unidirectional or reciprocal? Coil to spring action is described as a reciprocal directional reaction. Okay. Quad helix will help in what? Will help in widening the upper arch. It is used in cleft lip? No. It retracts the upper canine? No. Is a bite opening device? No. It widens the upper arch. Okay, maxilla. Question number 66. Removable appliances bring about what type of rotation? Removable appliances bring about tipping type of rotation. Okay. 67. Which of the following wires are also called as shape memory wires? Nickel titanium wires are shape memory wires. So option C is the answer. Question number 68. Catalan's appliance is given for a period not more than 6 weeks because it will cause over eruption of posterior teeth and thus there will be open bite. So it is not given more than 6 weeks. Okay, only for 1.5 months it will be given. So it will cause over eruption of posterior teeth if it is given more than 6 weeks. Okay, question number 69. In a child with mixed dentition, it is not indicated to correct transient class 2 malocclusion, class 3 malocclusion, thumb sucking habit, or all of the above. A patient is in a mixed dentition period. So, transient class 2 malocclusion needn't be corrected at the time of mixed dentition. So, option A is the answer. But you can correct class 3, you can correct thumb sucking. Okay. Question number 70. Suture to close last. Which one will close last? A spino-occipital will close last. Okay. Suture to close last is spino-occipital. First book on child dentistry was published by who? Joseph Hurlock. Okay. The first book was published by Joseph Hurlock. Question number 72. Proximal walls of a class 2 cavity on a deciduous. Question number 72. The proximal walls of a class 2 cavity on deciduous molar follows the directions of the enamel rod, converge towards occlusal surface, diverge towards occlusal surface, undermine the enamel which is very thin. Okay, the proximal walls of a class 2 cavity on a deciduous molar will converge towards occlusal surface. Option B is the answer. Question number 73. In an inferior alveolar nerve block given to a child, the position of the needle will be, comparing to an adult, it will be inferior. Okay, option B is the answer. Question number 74. High rate of failure after direct pulp capping in primary teeth is due to low vascularity or high cellular content. It is due to high cellular content of the pulp. There is always a failure for direct pulp capping technique in primary teeth. Question number 75. Kanner syndrome is also known as autism, osteogenesis imperfecta, trigeminal neuralgia, diabetes mellitus. Kanner syndrome is autism. Okay, option A. 76. Supernumerary teeth are all in all except ectodermal dysplasia, Gardner syndrome, cleft palate, and cledocrine dysostosis. You can see supernumerary teeth in a Gardner syndrome, cleft palate case, and cledocrine dysplasia. It is not seen in ectodermal dysplasia. Okay. Question number 77. Reducing the size of the X-ray beam is achieved by which method? You can reduce the size of an X-ray beam by doing collimation. Okay, so option C. Question number 78. Cells are most sensitive to radiation in which phase? G2 phase or G1 phase or both? It is most sensitive in G2 phase. Okay, cells are most sensitive to radiation in G2 phase of the cell cycle. Okay. Question number 79. What is the SI unit of effective dose? The SI unit of effective dose is sievert. Okay, effective dose. Question. SI unit of effective dose is sievert. Question number 80. Screen films differ from non-screen films is that screen films are sensitive to light than X-ray or ulta, opposite. Non-screen films are sensitive to light. Screen films are more sensitive to light. Okay, so option A is the answer. They are more sensitive to light compared to non-screen films than an X-ray. Question number 81. Bisecting angle technique is based upon which method? Okay, based on Alara principle, based on slope rule, or based on rule of isometry or convergence. It's an easy question. It is based on rule of isometry. Question number 82. Zygoma fractures can be best viewed by which technique? Okay, to view a zygoma fracture, you have to use a occipito-mental view or lateral oblique view or Townes view or lateral skull view. You have to use a occipito-mental view. Okay, to see a zygoma fracture. Campbell's lines are also seen in occipito-mental only. So, same answer for both the question. Okay. A zygoma fracture is seen in occipito-mental view and Campbell's lines are also best seen in occipito-mental view only. Okay. Now, question number 84. LE cysts are a feature of osteoarthritis of TMJ, chronic suppurative osteomyelitis, fibrous dysplasia, Gordon-Gall syndrome. LE cysts are a feature of feature of osteoarthritis or chronic suppurative osteomyelitis or fibrous dysplasia. Osteoarthritis of TMG. Okay, early cyst is seen in osteoarthritis of TMG. Question number 85. Focal film distance for a lateral cephalogram. To take a lateral cephalogram, you should at least stand 5 feet behind. So 5 feet. Okay, option C. Lateral cephalogram. Question number 86. Specificity of a screening test will measure what? So you are getting something true which is negative. So you have to go for a specificity. So specificity of a screening test measures a true negative. Okay, true negatives. Question number 87. According to hierarchy of evidence for scientific literature, randomized control trials are what type of evidence? They are level 2 evidences. Okay. RCTs, randomized control trials, are level 2 evidences. Russell's periodontal index scores range from 0 to 8. Question number 89. Which index would you use to assess the severity of periodontitis in epidemiological studies of a large population? So for a large population, to study the severity of periodontitis, you go for a periodontal index, isn't it? Go for a periodontal index. Okay. Question number 90. Next, 90. The choking off mechanism takes place after topical application of sodium fluoride. Choking off mechanism takes place after topical application of sodium fluoride. Question number 91. Biological width means what? Biological means full of connective tissue plus junctional epithelium. So sum of connective tissue and junctional epithelium. Option A is the right answer. Question number 92. Which of the following substances play a major role in regulating cell-to-cell and cell-to-matrix interaction in a cementum? Okay. So the substance which play a major role in regulating cell-to-cell and cell-to-matrix interaction is a proteoglycan. Okay. Proteoglycans play a role. Question number 93. Most commonly used technique of flossing. Flossing, spool method of flossing is commonly used. Okay. Question number 94. In which of the brushing techniques the bristles are placed at 45-degree angulation facing the occlusal surface of the teeth? It is done in a Charter's technique. Okay, Charter's technique. Question number 95. A split thickness flap is indicated when osseous craters are present, fenestrations and dehiscence are suspected, buttressing bone formation is present, 3-walled osseous defects are encountered. Split thickness flap is used whenever you suspect fenestrations and dehiscence. Okay. Question number 96. In hemorrhagic shock, hypotension occurs when blood loss is more than 30%. So 30 to 40% will be the answer. Okay. Okay. Question number 97. Tinel sign is meant for what? Nerve regeneration. Okay, to check whether there is a nerve regeneration. Question number 98. Squint test is used as a guide for selecting. Squint test is used as a guide for selecting shade of a teeth. Okay, the color of the tooth. Okay. Question number 99. The best gingival finish line for a porcelain jacket crown is a shoulder. Okay, PJCS. Okay, porcelain jacket crown, you go for a shoulder. Last question. The most common coupling agent are organic silicon compounds called as paraben or ligane or silane or chelane. The most common coupling agents are organic silicon compounds called as silanes. Okay. So with this we come to the end of 100 questions. Model paper 4. So do subscribe to the channel and revise these model papers. It is very easy to solve these questions. Okay. And if there is any doubt, please comment below the video for further explanation for each of the questions. Okay. Thank you.